All right, Jeff, thank you very much. More and more patients turning to surgery centers for their surgeries. Is your surgery center safe? It's the question after the death of Joan Rivers. Dr. Mark Mandell-Brown is here with what you should be looking for. Doctor, thanks for joining us.
Well, thank you.
Good morning. Good to see you. And we'll talk about Joan Rivers in just a second. But when you look at the number of surgical centers popping up across the country, over the last 30 years, quadrupling, almost as many as hospitals. Why are people choosing surgery centers over a hospital?
Well, and that's a great question. And more people are choosing surgery centers because of the privacy, the safety, and hospitals have a certain reputation, more infections and more serious diseases. And the public is really well educated about board certification for doctors. Only go to a board certified doctor in that field. But they're not really educated about surgery center.
And that's a good point. So when we look at surgery centers, do they differ from one another, and what should we be looking for?
And that's a great question. The best and highest certification is with a group called AAAHC. They're the largest accreditation body in the country, surveying over about 5,000 surgery centers, and they just celebrated their 35th year.
So they've been around a while, they know what's out there, so they go in and they will certify a surgery center.
They will. In fact, I'm a volunteer surveyor for them. I'll survey about 3 or 4 centers around the country.
And what are you looking for when you're going into those surgery centers?
Believe it or not, we have 700 items that we're searching for, that we're evaluating them, as far as infection control, safety, risk management, as far as their credentialing, as far as who's on their staff, if they're qualified, and we're looking at all those features.
Well, you make a good point, because at the beginning you said, you know, a lot of the times those that are searching and choose a surgery center is for the fact that it's private, it's smaller, it's a little more intimate. But are they able to care for somebody should something go wrong? And that's kind of the situation with Joan Rivers. Let's talk about that after the death of Joan Rivers. Now people are maybe asking a few more questions and looking a little deeper into surgery centers.
They are. And I brought a certification.
Okay, so this is exactly, if you're going into a surgery center, this is something that you should be looking for that would be hanging on the wall as you enter?
That's right.
Okay.
You should ask, the consumer should ask, are you a AAAHC certified center? In the Rivers case in New York, at the Yorkville Endoscopy Center, it was certified by a different accrediting body, and I'm on the board of trustees for AAAHC, so I have to say this is my own opinion.
Yes.
And that they're not as high a standard as what AAAHC sets. And so there were a few real major problems with the Joan Rivers case, and that just came out in the Center for Medicare, did an investigation, and they found some big major flaws with how Joan Rivers' case was handled.
And do you think, and your opinion probably again too, but maybe she had a relationship with her doctor and that's the surgical center he used, and so maybe the trust factor there?
The trust factor is there, but the real important point, whether you're a celebrity like Joan Rivers or you're an everyday citizen, you have to make sure that that surgery center is certified by AAAHC.
AAAHC. I mean, that's the bottom line, and that's what you need to be looking for.
That's a take-home point. So with the Joan Rivers, there were some major problems. An ENT doctor actually was not privileged to be working there. So when you apply for privileges at these centers, just like hospitals, you have to fill out applications, you have to have other doctors give you references. That didn't take place in the Joan Rivers case. She just came into the surgery center without being credentialed and evaluated her vocal cords. What happens is when you get credentialed, you're also supposed to be oriented. So when I go in as a surveyor, I check to see if all the doctors have had proper orientation.
Sure.
She may not have known where the crash cart was. She may not have known where the emergency airway supplies were.
Oh, my. Okay. A lot to think about when you're looking for that surgery center the next time. Dr. Mandell-Brown, thank you very much.
Okay.
Robin Megan will have a look at this morning's top stories.